Exercise management for chronic health conditions. It's common knowledge that regular physical activity and exercise have significant health benefits. However, the notion of exercise as medicine has only been developed over the last 40 years and is becoming an increasingly accepted concept among the healthcare profession. Exercise has been associated with the treatment of cardiovascular disease since the 1900s. However, the modern-day exercise professional can provide care and interventions to patients with cancer, chronic metabolic diseases, and musculoskeletal disorders. As a result, the exercise physiologist is gaining increased recognition by the healthcare system in the role of prevention and management of chronic health conditions. This report will go into significant detail on the role of exercise to the following subgroups: metabolic disorders, special populations, cardiovascular disease, diseases of the respiratory system, and selected neuromuscular disorders such as spinal cord injury, and will attempt to highlight that exercise shouldn't be limited to athletes and the healthy population only. Before commencing any exercise, the patient will need to fill out the relevant pre-screening protocols in order to determine the risk categorisation and suitability to commence an exercise program. This will include gathering both subjective and objective information on the patient, which will involve self-reported questionnaires, PAR-Q, low back pain form, ACSMs, risk stratification, and rationales for exercise capacity. This is a vital component of exercise prescription, particularly for chronic condition patients, as they often pose the highest risk. Integration with other healthcare providers is important, as GP referral may be necessary if they are deemed to be a high-risk patient. After the patient has completed the necessary pre-screening protocols and is either placed as a low risk or gained medical clearance, they may participate in the exercise protocols specific to their condition. Whilst being of age is not a chronic condition in itself, the decline in general health status and mobility associated with ageing will result in reduced capacity to carry out activities of daily living. Subsequently, the rate of physical activity declines with age, triggering a higher rate of chronic diseases such as coronary artery disease, arthritis, hypertension, diabetes, and obesity. As Australia has an ageing population, the role of the exercise physiologist is vital in the healthcare system for reducing limitations associated with ageing and the burden this may place on society. The elderly are categorised as having a sedentary lifestyle and are known for generally not being very active. In particular, they can benefit from regular exercise and activity through preservation of skeletal muscle strength and endurance, improve the ability to perform activities of daily living, enhance body composition, and improve their overall quality of life. Exercise will also reduce the risk of establishing chronic diseases such as those mentioned above. Based on this knowledge, the exercise physiologist should develop exercise interventions that increase daily physical activity levels and energy expenditure. The ACSM recommends the elderly should participate in moderate intensity physical activities at least 5 days per week. This can include cardiovascular activities such as walking, cycling, gardening, and swimming, and light resistance exercise with an emphasis on repetitions rather than weight lifted on non-consecutive days of the week. Diabetes. As of 2011, approximately 22 million people in the US have been diagnosed with diabetes, a metabolic disorder resulting in resistance to insulin or the failure to produce it resulting in hyperglycemia. The Centers for Disease and Control Prevention also consider diabetes to be at epidemic proportions in the United States. Exercise is considered one of the main treatment methods for type 2 diabetes and can also yield benefits to those with type 1. Exercise has both acute and chronic benefits to those with diabetes, including acute improvements in blood glucose, including a normal increase in muscle glucose utilisation, and more long-term benefits such as improvements in metabolic control, such as resistance to insulin, so control over that, decreased hypertension and lipids, improvements in body composition, and significant weight loss. Exercise is also considered the main preventative method in the onset of type 2 diabetes. Other psychological benefits associated with exercise are applicable to patients with diabetes, such as depression and stress management. Endurance, resistance, and range of motion exercise training should all be included in the management of diabetes with a vital goal of caloric expenditure. The ACSM recommends moderate intensity physical activity 3 to 7 days per week, depending on the training variables. Patients with obesity exhibit similar risk factors to those with diabetes mentioned before. These include increased body mass index, excess fat mass as a component of body composition, increased blood lipid cholesterol levels, hypertension, breathlessness, cardiovascular disease, and lower back pain and joint pain. Often tests for diabetes are done on chronic obese patients, as the condition in itself is a risk factor stemming from obesity. According to 2004 US bodyweight demographics, 66% of all US citizens are overweight, and the current trends demonstrate that obesity rates are constantly increasing. As exercise is described as the single most important factor to managing and preventing obesity, Exercise as a component of the healthcare system can yield astronomical benefits to this subgroup. Exercise benefiting in a 10% weight loss can cause a decline in 10 milligrams in systolic and diastolic blood pressure, up to a 50% decline in impaired fasting glucose, a decrease in the incidence of diabetes, and a 10% decline in total cholesterol. Acute weight loss also triggers up to a 20% decline in obesity-related mortality. There is, however, literature to suggest that longer-term weight loss resulting from exercise can be harder to maintain. However, when applied appropriately with nutrition and other lifestyle factors, chronic benefits may include decreased hypertension, body mass index, improved body composition, improved blood cholesterol profile, increased mobility and capability to perform activities of daily living, and a significant reduction in cardiovascular disease and diabetes. As there is still much social stigma surrounding obesity, and the psychological benefits obtained from exercise are also an important contribution to the disease management. These may include improved confidence and self-esteem, depression and anxiety management, and improvements in overall quality of life. Asthma and chronic obstructive pulmonary disease. Asthma and chronic obstructive pulmonary disease are the two major diseases of the respiratory system and are generally characterised by the presence of airflow obstruction. The two conditions differ, however, in regards to their outlook regarding treatment, as asthma is generally seen as a treatable and sometimes reversible condition in comparison to chronic obstruction, which cannot be cured but rather managed. COPD is thought to be attributed to either emphysema or chronic bronchitis, with the majority of patients experiencing symptoms for both. Whilst the major risk factors are cigarette smoking and air pollution, exercise is a mainstay in the treatment and management of respiratory function. Exercise can be particularly effective for the treatment of asthma and in some cases reverses symptoms of breathlessness experienced during moderate intensity endurance exercise. In regards to exercise prescription, the two conditions have similar goals but differ slightly in intensity, as asthma emphasises on training at a level just below the anaerobic threshold in comparison to COPD, which will require a lighter intensity. However, they both predominantly require cardiovascular training on most days of the week for a duration of 20 to 30 minutes per session. The reported exercise benefits for COPD are improved muscle respiratory strength and endurance, cardiovascular reconditioning, reduced dyspnea, improved body composition, decreased shortness of breath during activities of daily living, and decreased fatigue in general. There has been a wider and less consistent outcomes reported on the effects of exercise on asthma. However, our understanding is the benefits are generally similar to that of chronic obstructive pulmonary disease and have been described as decreased dyspnea, decreased airway obstruction, increased exercise tolerance, decreased breathlessness, and overall fitness levels improvements. Spinal cord injury. While spinal cord injury may not be as prevalent as other chronic conditions such as obesity and diabetes, it plays a major role in the transmission of sensory and motor information required for movement and basic functioning, and is considered vital for life. Of the 52 million injuries per year, almost 40% die before reaching the hospital. Due to its high sensitivity and importance, there is often stigma and controversy surrounding the best methods of treatment for patients to make a return to activities of daily living and the exercise prescription that this may entail. Subsequently, there is a varying degree of severity associated with spinal cord injury, ranging from quadriplegia to mild lower back disc complications. This will obviously influence the exercise prescription and benefits associated with it. In general, the functional rehabilitative perspective suggests that exercise for these patients should focus on basic mobility and range of motion, upper extremity functionality, forward and backward propulsion, and increased capacity to perform basic activities of daily living. Some patients will be limited to using hybrid exercise equipment, whilst others make a full recovery and therefore be able to reap the benefits of standard exercise training such as cardiovascular and musculoskeletal improvements. The benefits of exercise for patients with a severe case of spinal cord injury have been described as improved walking ability, basic neural pathway recovery, ability to perform activities of daily living, and upper extremity strength. Upper extremity strength training has been noted to have the greatest benefits for patients with paraplegia, significantly increasing their ability to perform activities of daily living. A stroke occurs when blood flow to the brain is interrupted, causing a disabling attack or loss of consciousness. A stroke is caused by the build-up of plaque in the arteries, causing arteriosclerosis, can be attributed to having the signs and symptoms of cardiovascular disease, which is largely preventable through exercise. As mentioned previously, pre-exercise screening is important for all chronic condition patients, however cannot be emphasised enough for stroke patients, as they may exhibit no obvious signs or symptoms. However, incorrect exercise prescription could have severe consequences. Particular attention should be paid to ensure that resting blood pressure is below 200/110. The primary aims of rehabilitation for stroke patients include restoring balance, movement and coordination. As such, exercises generally involve passive movement, functional movements such as sit to stand, basic strength exercises and range of motion techniques. Exercise plays a major role in the prevention of stroke by lowering the risk factors that may increase the likelihood of a stroke event occurring. In particular, exercise lowers the cardiovascular risk factors which may eventually prevent blood flow to the brain, such as improving blood cholesterol profile, improving body composition and decreasing the cardiovascular workload the body endures each and every day. Exercise also has significant benefits for patients who have already endured a stroke, including increased functional capacity, decreased blood pressure, improved musculoskeletal functioning, improved balance and range of motion, and decreased spasticity in the muscles of the paretic side. Based on this, exercise should be the backbone in both preventing and treating stroke events in patients. To conclude, there are a number of chronic health conditions in which only a few have been mentioned in this presentation which can be prevented, treated or cured through consistent exercise. The prevalence of these conditions which fall under this category highlights the growing importance of the exercise physiologist in the healthcare field and recognition of the services they offer. A decrease in chronic health conditions, particularly those that are preventable, will decrease the burden placed on society and the healthcare system. The exercise physiologist has large shoes to fill in ensuring a proper exercise prescription and rehabilitative methods to ensure this, as the benefit of exercise for most of these conditions have been proven to be somewhat astronomical. The notion that the exercise profession should be applied to athletes and the healthy population only is dated and will continue to become an increasingly important component of the treatment and management of disease.